May is Bladder Cancer Awareness Month. I'm going to talk about bladder cancer. What is bladder cancer? Bladder cancer is a disease in which the cancer cells develop in the lining of the bladder. It accounts for 3% of global cancer diagnosed and is prevalent in developed world. It's 4 times more common in male than in female. The commonest type of bladder cancer is urothelial carcinoma. What causes bladder cancer? The number one risk factor for bladder cancer is cigarette smoking. 50 to 60% of bladder cancer is caused by cigarette smoking, environmental or occupational exposure to dye, paint, rubber, metal, firefighters, dry cleaner, hairdressers, farmers that use fungicide. Other risk factors include chronic bladder irritation, infection with schistosomiasis, exposure to radiation, obesity. How will you know you have bladder cancer? The number one symptoms is blood in urine, which could be bright red or Coca-Cola color, pain on urination, difficult in urination, and pelvic pain. However, it's not all blood in urine that is caused by bladder cancer. Other causes of blood in urine include prostate cancer, chronic bladder infection, and tumor infiltration into the bladder. How will you diagnose bladder cancer? The first thing to do to diagnose bladder cancer is cystoscopy. Using a scope to look inside the bladder, urine sample is analyzed under microscope for cancer cell. Other staging investigation include CT urogram, MRI urogram, CT chest to rule out metastasis to the lung, abdominopelvic MRI to ascertain the extent of disease involvement, and also to rule out metastasis to the liver and other abdominal organ. Treatment of bladder cancer depends on the state of the disease and the grade. Bladder cancer is stage 0 to stage 4. Stage 0 is the lowest stage and is carcinoma in situ. Stage 4 is the highest stage and it has spread to other parts of the body, such as the liver, the lungs, the brain, and even the bone. The low grade, the cancer cell resembles the normal bladder cells, is slow growing, and is unlikely to invade the mucous layer. For the high grade, the cancer cell has no resemblance with the normal bladder cells. It's aggressive and it can invade the mucous layer. The treatment modalities for bladder cancer include transurethral resection of the bladder, which involves removal of the bladder tumor, sending it for histology for definitive diagnosis. Intravesical therapy, instillation of chemotherapy or BCG into the bladder to destroy the cancer cell. Partial cystectomy, removal of the part of the bladder. Radical cystectomy, removal of the whole bladder and the urinary diversion. Chemoradiation, using chemotherapy and radiotherapy to destroy the cancer cell. Chemotherapy, using chemotherapy agents to destroy the cancer cell. Immunotherapy, using immunotherapy to destroy the cancer cell. I urge all men and women to quit smoking, quit alcohol consumption, involve in physical exercise, and minimize exposure to chemicals to reduce their risk of developing bladder cancer.